like that. I mean, you should not have things like that. They should fall on your forehead. They should fall on the forehead. This gives softening appearance. So very important, your hair should be falling onto your forehead. Now this is where it is. Can you see these hair going straight up? And can you see these hair all curling down? It was this patient who prompted me in the first place that, wow, we must look, where are these grafts? Are they present over there? Yes. So I bring them over in this transition zone. The naturalness is all over here. This is density. So I do not worry about this place. I worry about the naturalness. And then you can see all these here, the front ones are curling down, the fronts one are curling down. This is hair transplant. This is what I do initially. And teamwork, I mainly used till about few months back, I was only doing loop magnifications, and those pictures which you saw with one single hairs, you know, very fine ones, they were done with loops. In Asians, our hairs are very thick, right? In Caucasians, they've got very thin hair. So for them, you need a little bit more magnification. For us, we don't need magnification that much. So most of that, but now I have shifted over to microscope dissection as well. But these are all these pictures are the patients who had no microscope used. Right. This is again, you can see, now this is where I would do a follicular unit extraction. I only need this small little area, about 50-60 grafts, right? But then you can have it done in the beard. Now see, I have taken the donor area so that I can put some of the black and some of the white. So this is what it is. So you can basically do any part of the body, and you can take from any part of the body, and some of the people who have had a burns can have a real good improvement. Right? So these things can be done even for those people. Look at this burn and look at him now. Right? And I've made some of this as well. Now this is, you know, this is the one surgery, this is after 2 surgeries. So naturalness, can you see all these hair grow in the front? Naturalness should be there. So my main impact about hair transplant is naturalness. They should look very natural. Look at this eye and look at that eye. There is a difference. It is because of these hair, but that difference is when I say this is self-esteem being restored. And this is priceless. For the rest is MasterCard. Right? Again, you will see. Now one more thing. This is where I transplanted. This is 5 months. This is 1 year. So the same number of hair, when they grow, as the hair grow, it keeps on getting thicker in the volume. So that is what it gives over here. Right? You can have it for females. Look at the eyes. Look at this thing. Now, I'm not really impressed by my own result of this thing. That was about my first 5, 10, 15 patients. But look at the difference in the eyes. Now, this is a framed face as compared to that one. Same person, a difference of 10 months. Look at the difference. This is what we want to achieve. And then, you know, he had, luckily his donor area was excellent, so I was able to manage about 48, 42, 4300 grafts, and you know, he had a good result. Okay, this was Sultan Saab when he first came to me. Right, you can see the donor area. You can see that it is you know, he is type 7 with some touches on the top, but this is what it was. Right, we had 2 surgeries. Yeah, 2. We had 2 surgeries done. This is after 1 surgery. This is the scar you can see, and the planning for the second surgery. Planning for the second surgery, and you can see how fine. You can actually see how fine the scar is. That is the scar. That is the scar going on. That is a scar, right? And then you can see this is after 1 surgery. This is 1 surgery. Right, this is 1 surgery. You can see this is 1 surgery. You can, you know, you can see the hairline, and then we do the second surgery. Sorry, the pictures are double. Now this is the second surgery. Now there is a smile as well. And that is what it is. Thank you about this. So and the rest you can, he is there. He can tell you exactly what he has been through, right? I encourage my patients to tell. If somebody has told me, there was one patient, he said, well, I told him like this, I had this problem, but I did not tell him that. And I stopped him there. I said, no, tell them exactly, because I don't want you to do something wrong for me as well. Tell them honestly your experience, good and bad. You might fly to US, in a plane, you have a very comfortable flight. The next time you fly, it could be a very bumpy flight. The person who would be first time on the airplane on a very bumpy flight, trust me, he'll tell everyone never to sit on a plane. So it's a personal experiences as well. But generally, of 95% of people have a very smooth ride in a hair transplant. I tell everyone at least 2 sessions for everyone. But those who are type 6, type 7, type 5, they could be 3 sessions. But generally speaking, you must come to me with the mind of 2 sessions. In 2 sessions, I can give you something which would be really worth it, right? And the results I have, I can safely say my best results with world any person's best results I can compare. He's sitting there. Tell me how many of you can tell that he has had something done?
No.
Right? This is what I say. Now, it is not a very dense thing. I mean, he is, mashallah, in his mid-40s or something like that. But, that's all. And he has had a very short haircut. You can't see, if he turns around, you can't see the scar as well. Right?
Even if you try to look for a scar, you won't be able to find it.
Right. What you can do is that, if he allows me, you can come and you can have a look at it. If you want to, there would be some concerns. Sometimes when sitting on that side, you might be sitting and saying, yes, okay, fine. But then you would like to go and say, okay, fair enough. How does it look? Oh, okay. Now, for you, it will be, he didn't have any hair, but you can see the density what I have given. You can see the looks from the front, how dense it looks. You can see, now this is optical density. You can see the area which I have left. You can try to just have a look at the scar and you can see, okay, this is the scar, this is how it is, and that's it. So this is the hair transplant. And one of our patients, mashallah, he had a wonderful results, and quite a few of my patients has had. This is on an average, anybody who gets 2 sessions on an average would look like him. This is my average results.
How long was it?
His first surgery was done when?
I think it's been 3 or 4 years.
3 or 4 years.
Well, I think I was almost the first person in Birmingham to have this surgery. And me having a surgery, because I've done everything in my, in the hair transplant book or